In terms of digital implant dentistry for the future, I think that new materials will coming out. Scanners will be more accurate, and especially you will tend to replace human hand by machines. Like for example, 3D impression for model impression. It will be nonsense to have cast anymore in the clinic. You only need 2 or 3 machines to in 1 hour print 3 to 4 to 5 models. Now the CAD-CAM milling machines will be faster and accurate, and the biomaterials that we'll use would be enormous and will have major advantage, biological advantages. Now I show you this case because we are already starting to produce different materials in the clinic. And for example, this is a situation where it's a fully guided situation. That means that it's a fully guided protocol, but we're going to place acrylic just for Pontic formation. We don't want immediate loading. We just want the Pontic formation on the day of the surgery. Now you start to incorporate your digital technology in our way of thinking. We know that one abutment one time reduces marginal bone loss. We know that Pontic sculptures from day one avoid recessions and social problems with patients. And we know that we have to capture since day one. Now, with digital technology, nowadays it's possible to plan this. And so we plan it from our implant softwares. We plan our surgical guide like I showed you. Now you're ready to place your implants according to that planning. You plan your implants and you can see that everything falls down in the correct position. Now, this is a situation where we use the clear acrylic situation. Especially is more aesthetic for the patient, because if the patient doesn't wear nothing, even if it has the Pontic, sometimes it's too whitey or have special problems. But one of the things that is very good is that it's highly polished. Highly polished from a biological point of view for soft tissue is an advantage. The desmosome adherence that may produce is awesome. And one of the things it also serves as like a hard membrane, so the biomaterial in the Pontic situation doesn't come out. So it holds the particles there and they do not come out, which is an advantage for a socket preservation type of style. Because when the prosthodontic receives the final work for rehabilitation after 8 weeks, as you can see in the picture, it receives a pretty stable situation. So digital technology makes you better because you're better planning, you're better executing, and you have the potential to use more biomaterials that have more biological sense than some of the traditional ones. So here's an example of the future situations and what's coming more in the future. Now, as a take-home message, as I told you in the webinar that I did on zirconia, I don't like much the take-home message. I like the clinical message, because once again, if it's the take-home message, you go and stuff it on a drawer and it stays there. But if you use a clinical message, then on Monday you will probably think about this situation. And the situation is that if you're going to use the digital workflow in implant dentistry, then you have to remember that it's about the 3 things. It's about the technology, but more especially incorporated this technology into the research that you know and that we know from the past. And of course, that you still have that clinical expertise that will guide you through the process. So it's like that pyramid of the evidence-based dentistry, but now you have to incorporate technology. Technology will be the future. It's the present and it's the future. So in a couple of years, dentistry will be no longer like we used to be 10 years ago. So I hope this webinar helps you a little bit. Of course, talking about implant dentistry in digital workflow in an hour, it's not enough. But here stays a little bit of what we're doing today in the clinic. So I hope you all enjoyed this webinar. Again, I want to thank you, Rui Pereira da Costa and João Borges, for the magnificent work they've been doing. And I wish all the best, all the luck in the world. Thank you very much. I'll see you in the near future.